My name is Kathleen. I'm a family nurse practitioner, and today we're going to talk about high blood pressure. And before I get started, I want to give a shout out to God worshippers, leaders, for taking this initiative of educating our population on different health problems. And also a shout out to Brother Jay for approaching me with this project. And today we can get started. We're going to talk about high blood pressure. Our objective today is to talk about what is high blood pressure, what is the GNC-8 classification of high blood pressure, symptoms, risk factors, and prevention / non-pharmacologic treatment of high blood pressure. So what is high blood pressure? So high blood pressure is known as a silent killer, meaning it usually have no symptoms. But when we looking more into the definition, high blood pressure is when the pressure or the force of blood pushing against the blood vessel is constantly high. So constantly the blood is pushing through the artery walls, pushing through supply our body. And we know blood supply is a major thing for our body, for us, for our heart, brain to function. We need the blood pressure, the blood supply. So in a hypertension instance, we have the pressure constantly trying to get through the arteries with a high force. So we're going to see the chart of GNC-8 classification of high blood pressure. So in a minute, you're going to see the chart. And when we look at the chart, we can see what a normal blood pressure, which is a systolic less than 120 and a diastolic of less than 80. Then we go on, we see the pre-hypertension, the hypertension stage 1, the hypertension stage 2, and then lastly, we see hypertensive crisis, which is when the systolic is higher than 180 or the diastolic is higher than 110. And at this time, it's a medical emergency. If you're at home, you should go to the emergency room. And even sometimes you may be at your doctor's office. They may recommend that you go to the emergency room as well, because that pressure is too high to be walking around. Anything can happen with this pressure. And for the other stages like pre-hypertension, you can see that's when your healthcare provider would recommend low salt diet, lose weight, some other management at that point. Then some of the symptoms we're going to talk about is we will see here. Single best way to know if you have high blood pressure is to get your pressure checked. You can get it checked at your doctor's office. You can check it at a local pharmacy or at a health fair. You get your pressure checked. Because if you're walking around with your pressure high, not knowing, and it can cause other serious health problems such as strokes, heart diseases, kidney disease, and so on. So one of the symptoms you may have is a severe headache. Again, sometimes you have severe headache, you associate it with other problem, but it could be from pressure being too high. Chest pain, difficulty breathing, dizziness, abnormal heart rhythm, and nosebleed. So these are just some of the symptoms that someone may present with. Then we go on to talk about the risk factors. So when we talk about risk factors, we have modifiable risk factor and non-modifiable risk factor. And the non-modifiable risk factor means there's nothing we can really do about it, such as family history. If your parents have high blood pressure, there's an increased risk for you to have high blood pressure. Age. The older you are, the more likely you are to get high blood pressure. Gender. So research show that men up until age 64 are more likely to get high blood pressure. But after that, at the age of 65 and higher, women are more at risk to get high blood pressure. Then we see race. Race, of course, you know, African American, Black population, we are more likely than other race to have high blood pressure. And then we have the modifiable risk factors such as obesity, overweight, unhealthy diet, drinking too much, stress, lack of exercise, and smoking put us again at a risk of getting high blood pressure. And what can we do about it? So the prevention / non-pharmacological treatment is to have eat a well-balanced diet, meaning a low-salt diet, a diet of vegetable and fruits mainly, and can help reduce your pressure. Managing your stress, maintaining a healthy weight, regular exercise, quit smoking, limit your alcohol intake, and most importantly, the other way to prevent blood pressure is to know if your pressure is high. So it's to get your pressure checked or self-monitoring it at home. And of course, there's always cases where an individual, or you can be doing all these things and you find that your pressure is still high. And at this point, you need to seek help from your primary care doctor or your practitioners. Again, don't forget, we give you all the information. The rest is on to you. I hope you enjoyed this video, and I hope you find it helpful in the management of your blood pressure. Again, thank you for watching.